It's live.
Hi, how you doing? This is Dr. Sharyl Truty, and I am here today with our inaugural Health Lunch Hour chat, where we discuss topics that are meant to optimize your health. My name is Dr. Sharyl Truty, and I'm owner of Balanced Physician Care here in the Jacksonville Beach area. And I am here with one of my very favorite people who I couldn't think of better to start off our program with than Carol C.C. Miller. Carol is a positivity consultant, and she's touched millions with her work, not only across the nation, but across the world. She does a lot of consulting around positivity for both individuals, groups, and businesses. And she is founder of a group near and dear to my heart, Positive Focus. Welcome here today, Carol.
Thank you. Thank you. I'm happy to be here. And I think with our technical challenges that we just faced, it's a great topic that we're covering today.
Absolutely, absolutely. Today, we want to talk a little bit about resilience, and it seems like, why would we talk about that in a healthcare talk? But it was recently, a great post on Dr. Andrew Weil's blog about resiliency, and so I think it kind of is a good topic to talk about in regards to health. Tell me a little bit about what do you think of when you think of resiliency in that word, Carol?
I think about as far as how you proceed to get through any kind of challenge. Like things do come up in our lives, whether it's a health challenge, a financial challenge, a relationship challenge, and the more resilience you have with it, the easier it's going to be to get through it.
Yeah, absolutely, absolutely. Um, you know, uh, why is resiliency, important? And I think, from a health aspect as a physician,
Mhm.
resiliency is trying to sort of stop that overreactive stress reaction, which,
Yeah.
we know that, chronic stress definitely affects the body in many, many ways. A lot of people use that term adrenal fatigue. Uh, a lot of us in the medical community, more conservatively, sometimes prefer the term HPA axis dysfunction. But whatever you call it, it really just means that stress begins to affect you physically in your body. And so when that happens, the question is, how can we change that? And one of the things that can do to change that is change how you look at the world, right?
Right.
And in a sense, that's sort of what resiliency is about.
Yeah, I absolutely think so. And it just goes back to me on that we've really been programmed in our lives to focus on what we're not doing right more than what we are doing right. And one of the examples I always use is in school, if you take a test with 100, if you get 96 of them right, the top of the paper still says -4 instead of plus 96. So we've been trained to focus on what's not working rather than focusing on what is working and reframing our challenges into a more positive space. I mean, certainly, as you know, Dr. Sharyl, that there are things that go on in our lives that we don't have control of, but we do have control of how we respond to it.
Yeah, absolutely. And, I think a lot of us feel that we go through our day and we go, boy, how many people when they start off their day go, yes, today is going to be a great day, you know? And I think a lot of us, the dark side, even those of us that, are working on our positivity, we don't realize that a lot of times we start our day and we know, especially work days, your
Mhm.
average day where there's a lot going on, you're juggling family,
Yeah.
you're juggling your work, you're, juggling other people's needs and wants. And, it's not the holiday, it's not the weekend. And you're like, oh my gosh, I'm just trying to make it through the day, and I think resiliency talks about, you know, how can we sort of reframe that in the sense of knowing that, yes, in one sense, maybe there's going to be some difficulties, but do we have to already feel bad about them before they already happen?
Yeah, and I mean, if we also realize that the difficulties that we do face enhance our celebrations, because if we did not have contrast to what's going on, I think we'd start taking things for granted. So the more that you see that difficulty as just a, it's a roadblock or a stumbling block, but it's not completely stopping you, is what's really, it's about what resilience is all about and what you're focusing on. Because it's easy, especially for a health crisis, if it's right in front of you and you've been given a scary diagnosis, it's very easy to go into the what could happen from a negative standpoint. It's interesting to me because I am not a medical person, but anytime somebody gets a health crisis and they're like 80% survival, it's amazing to me how many people focus on the 20% who don't survive. Like, it's still a good number. So let's focus on what's in front of us and moving forward with that.
Exactly, exactly. And part of that, in resilience is, one of the components is accepting that, challenge and change is inevitable. And so, I think a lot of us get very comfortable with things
Mm-hmm.
just sort of the way they are. And I think in a sense, our brains are programmed like that. Our brains are taking in so much at one period of time. And so the way that the brain handles that is to make certain things very routine, things that you do on a regular basis, just routine. And they go into processes in your brain, your subconscious, and other processes where you don't consciously think about those things.
Right.
And it's our way of handling it. But in a sense, that can make it difficult for us to accept change or to change ourselves because our brain is sort of put it on automatic, and it's just very easy to keep things on automatic. And so the challenge becomes, okay, not looking at change necessarily as bad, but sort of saying, okay, something's different here. It doesn't have to mean that that's a threat.
Yeah, and I think some people, it's just common for us to even change that we want to happen, can be scary. Look how many people stay in jobs that they don't like or relationships that are not healthy for them because they know what's expected of them. They may be uncomfortable in that situation, but they still know at the end of the day what's expected of them. And we kind of focus on, oh, it could be worse. Well, it could also be better. And one of the things that I like to use, especially if I'm going into a meeting that I'm not looking forward to or anything, is that went better than expected. So it still allows it to not be perfect, like what the ultimate I want it to be, but I'm also focusing on it went better than I expected to.
Yes, I love that. That's something that you and I have talked about a lot. And I think that is a really great phrase. So if for you, this sort of topic of resiliency and trying to bring resiliency into your life, is sort of hitting, maybe a button saying, yeah, maybe this is something I need to look at in my life. I like that tool that you often use is saying, okay, today really went better than expected. And I think we can begin to, if we say that to ourselves, at the beginning of the day, objectively, start off by saying, okay, what am I fearing about the day? And then asking ourselves sort of that Byron Katie sort of, check in. Okay, is it really going to be like that? Do I really know it's going to be like that? Or am I making up a story that may not actually play out? And then at the end of the day, to check back in and go, boy, that really did go better than expected, sort of bookending the day like that.
Yeah, and I think doing it day by day is a great thing, but it's like many things in life, it takes practice. So you may not notice that change today. You still may have a more stress worried day than you thought you were going to, because now I'm practicing resilience. But if you let it build up, I often use, like, if I went to the gym one day and I was perfectly buff, I would be so excited about that. But you go to the gym to start a routine to get healthier and work out. So I'm always talking about I'm exercising people's positivity muscles in the work that I do.
Yes, yes, absolutely. Just like anything else, um, it takes, some effort to create, that change. Just like it takes effort to create a new habit with exercising,
Mm-hmm.
with eating right. It also does in your mindset. The great thing, though, about changing your mindset is that, that can be free, right? It doesn't
Right.
necessarily cost you anything to just, start that habit and work on it. It can be something that you just start tomorrow, and like you said, biting off one simple sort of thing at a time. So if you had to sort of give some advice, to someone who said, I would really like to look at, being more resilient in my life, letting when things come into my life that are stressful, when I'm faced at a situation at work or at home that
Mm-hmm.
really affects me, and I seem to get these things over and over. How can I sort of go with the flow with that? Sort of that's what resilience is, without letting those things um, bother me, get me upset and sort of
Yeah.
change my emotions. What would be, some of the top 2 or 3 things that you'd recommend to someone to get started?
Yeah, absolutely. And my top one would be to be gentle with yourself, because it's absolutely okay if you've gotten bad news or a loved one is having a challenge or whatever, to be sad, angry, scared about things. That's a normal feeling process. It's when you allow that to take over and run your life is when you're getting into the chronic stress that's going to affect it. So be gentle with yourself that you're having a bad day or a bad moment. And the more you practice that, you're going to realize, wow, I haven't had a bad day in weeks. And now all of a sudden, my bad days are turning into bad moments rather than full out bad days. Secondly, I would recommend to take some deep breaths when you're going through that sucker punch kind of feeling, because often when we're scared or hurt, we're constricting ourselves. So we're not even getting the blood flow to our brain and to our heart to make wise decisions by. And then the third would be to really focus on appreciation. And Dr. Sharyl, you've probably heard this in the work you do. I have certainly heard it. Hear it so many times from people who have had maybe breast cancer or something like that. And they say that they would not wish that on their enemy. However, it's been a gift to them because they truly appreciate life now. And I don't know why it seems to be that we have to go through a life-altering experience to really appreciate life, but it does happen for a lot of people that way. So the more you can focus on what is going well in your life and appreciate from there. If it's something that you're really struggling with, it may be that you're going back to, I appreciate that I'm breathing on my own. I appreciate that I have a warm bed to sleep in. I mean, I have a relative who uses oxygen to stay alive. And so I absolutely appreciate that I can breathe on my own. And that's something that I would normally take for granted. So being gentle with yourself, taking some breaths, and appreciation are probably my 3 top things.
Yeah. Yeah. And I like the question. I try to, I love all those 3 things. I think that those 3 things are perfect. Being gentle with yourself when that moment suddenly occurs. And then when that moment occurs, taking a deep breath and, just giving yourself space to say, okay, can I sort of change, my reaction to this?
Mm-hmm.
Because that's always, our mind tends to jump to what it habitually responds to. Everybody
Right.
talks about triggers, and so all of us have them, And, if we can stop ourselves before we trigger that automatic reaction, and then go through exactly those steps, being gentle with ourselves, taking a deep breath, and then, like you said, focusing on appreciation, focusing on something else. A question, a phrase that often helps me a lot, that I've been trying to incorporate more in the past couple of weeks, especially once I heard this, is saying to yourself, instead of saying, why is this happening to me, say, why is this happening for me?
I think that is a great one.
I know if you take a second, when you're in that moment and you say to yourself, why is this happening for me?
Yeah.
At first your brain goes, what? What do you mean, why is this happening for me?
Yeah.
In what possible way is this, right now what's going on for me?
Well, and that is so true. And I can even think of examples in past jobs that I've had that I really didn't like. And it was why me at the time. And I would not be doing the work I do now had that job been so stressful that I left it. Like I can be that comfort girl that even if I don't like it, I know what's expected. So in that time of my life, I needed that big wake up call to say, no, this doesn't work for me anymore and move on.
Yeah, exactly. And so, and maybe at that moment, you really, maybe in the end, you don't change your reaction that particular day. But again, be gentle with yourself. At least you took that question, at least floated through your mind, or it occurred to you that you wanted to do something different.
Well, and I think it's on a level of what that stress is. If it's something small, it's going to be easier to go into the how is this for me. And if it's a bigger challenge, it may take a little longer, but it is possible to get there. And again, the more you practice it, the quicker it's going to come for you.
And again, to bring it back around to the health, the whole reason why, we're just discussing this, to begin with, is to say to yourself, okay, so much, we're often faced with so many challenges we're balancing, maybe something we usually have simultaneously, something at home, something at work, something in our health, something with our children, something with our pets. And, as all of those sort of stack on top of each other at any given moment, when that one more thing sort of happens, then we sort of begin to feel all stressed, and we're walking around with, that tightness in our neck and a tightness in our back. And, we're just really tired, and we're reaching for, that third cup of Starbucks coffee, just because we need, or we're reaching for that donut because, we are so stressed that we need, our brain wants something to, just soothe it and calm it. And so, and then that's where, this begins to affect our health, because, we may not want to reach for that donut. We may not really want to reach for that cup of coffee, but, in a sense, we're feeling so desperate that we need to. So how can, like you said, we just sort of say, okay, how can we change our reaction? Because if we change our reaction and we look at resilience, maybe then those things are not going to affect our health quite as much.
Well, and I think it's really important for awareness, because if you're aware and conscious of what you're doing, then it's a choice. Like then reaching for that donut could be, you know what, it may not be the healthiest choice, but in this moment I need it. Or it could be, you know what, this isn't healthy for me, so I'm not going to eat that donut. But often we just go back to old patterns and we're not even thinking about it. And then we don't have a choice when we're not aware of our actions, or we're not aware of what we're thinking or speaking about. So the more you can focus and be attentive with intention. I always start my morning off with things I appreciate to set the day up for more appreciation. So I do begin my day with how I want it to be. I want it to be easy. I want it to be fun. I want to learn something new. I want to make a positive impact on people's lives. And so I set those intentions up, and that helps me prepare for, if I deal with a challenging client or something like that, or maybe a challenging news story about something that's going on in the world, that I'm allowed to still react from it, but I come from an awareness of reacting from a space of what I want rather than reacting from a space of what I don't want.
Yes, absolutely. And there are a lot of world events out there that can, cause, us stress, because they hit close to home. They hit things that were very, mean a lot to us for whatever reason and from whatever background. And, some of that is out of our control. I mean, we will try, on our individual level to make change. And, all of us for some reason or another will maybe engage in certain activities to make that change more than others. But that doesn't mean just because we're not actively, creating change that we don't want to see that change. And so, like you said, some of it becomes, just, overwhelming. And so, how can, like you said, we react in a way that we want to, and that's more constructive and more positive. And then that leads to sort of more of a confidence and, a personal good feeling throughout our day. Sometimes when we respond in ways that, are not resilient, we then have sort of this cascade of, guilt or anguish or, just it affects us even more and sort of snowballs because, maybe in the moment we didn't react how we thought we would like to, but then all of a sudden afterwards we'll have guilt that goes even further. Just bringing from a personal experience, there was somebody in one of the groups, networking groups that I'm a part of. And, he just started a new position. He's in front of the group, kind of organizing it and overseeing, the meeting and how it goes. And, he was his first day at the meeting and he forgot to include one of the very important people, in his, agenda that day, and the anguish that I saw it caused in him, was just, very apologetic and took like 5 extra minutes saying how much he was sorry. And then again, this week at the meeting, he brought it up again a second time. And I'm thinking to myself, I'm thinking, most of us are okay with it. Like it really wasn't that big of a deal, and I just feel like, it just took up so much of his time. And he went out and bought a gift for this person and presented. And I'm like, I just have to wonder, if that in itself just creates more stress and more problems, when we're not able to just sort of let things go. And I think, resilience is a very, maybe another side of a coin of just learning to let things go a little bit when maybe things are not exactly the way we want them to be.
I think so. And I think it's absolutely goes back to, again, being gentle with yourself, because I live and breathe positivity because of the work I do. Does that mean that I'm positive and happy and kind 100% of the time? Absolutely not. It does mean
you're not.
Don't tell anybody. But it does mean that I am attentive to it and I focus on it. So I absolutely refrain from unkindness or any types of things when I do step into fear. But, I get angry and I get sad and I get disappointed like anybody else does, but I have the tools to move through it quicker. I was just thinking with your example, when I'm doing public speaking and after the fact, I'm like, I forgot to bring up this point that was really important. And I'm like, Carol, there's not one person in the audience who knew that point was important but me. So nobody left thinking like, oh, I can't believe she left out the important point of her speech. And so I catch myself being most unkind to myself more than other people. And the more that you can be gentle with yourself, if you've done something that you need to ask for forgiveness or accept forgiveness, that's part of it as well. But letting go, what you say is your integrity. How somebody else interprets it, that's, you can't control how other people are going to interpret what you say.
Yeah. Yeah. And so, I think, in this article, in this blog of Dr. Wiles, about
Mm-hmm.
resilience, there is a physician that, sort of helped, present this blog. And he says, there are 4 ways that, he recommends, achieving resilience. He says, first of all, accept that change is inevitable. And realize that nothing in life stays the same, and that, and on one point it kind of makes you feel like, well, that means that the good stuff won't last forever, and that kind of makes us sad, but also the bad stuff won't necessarily last forever. And so
Well, and if we can stop choosing good and bad, like it's an
yeah,
experience,
right,
and we get to determine, like, because the same experience you might find to be bad that I may enjoy. So it
yeah,
really is a personal view of it. And so the good may not last forever, but that doesn't mean other good isn't coming in. It
yeah,
just changes and morphs and things like that.
yeah. And then, the second part, he says, is reframe how you think about stress. And that, though, it takes, I think, that takes a little bit of work to get there.
Yeah,
I think it's easy to say, okay, well, you need to reframe how you think about everything, but you're still yourself.
yeah, it's
And so,
practice.
how do you separate, yourself from yourself so that you can think about things differently?
Right.
And I think, like you said, going back to your tools, of, just trying to take a pause more when you kind of feel those emotions rise up. But then it's also, doing some other things like, meditating, or
Mm-hmm.
doing some mindful work, because as you do some of those practices, you begin to sort of almost like become an observer of yourself. And that, can be very powerful
Yeah.
in helping you to reframe, things in your life.
One of the statements, and I don't remember where I heard it from, but I really use it a lot, is observe rather than absorb.
Yeah.
So when you're in any situation and it's stressful or whatever, you can observe it for what it is and just, pay attention to it. But it's when we absorb other people's negative emotions or absorb their fears, then that turns into our own internal stress. So observe rather than absorb.
Yeah, exactly. And I think, as you begin to be able to observe things,
Mm-hmm.
then the more, and like you said, the practices can be simple, and they can start simple, with, like you said, driving in the car to work. Almost all of us have to do it. If you don't have to drive, you usually have to walk. If you don't have to walk, you have to bike. Usually there's
Yeah.
some spending time going, unless you're like my husband, who walks from the bed 2 steps to the desk, and you work from home. But I mean, for most of us, there's points in our day where we're traveling, somewhere else, and so that's a great time to, if you don't have a lot of time. I don't have 10 minutes to meditate every day. I don't have a half hour. That's a great time to, like you said, just stop and observe. So rather than maybe putting on the radio, like you said, maybe sit down and think of things that you appreciate, or just observe your surroundings.
Yeah.
We live here in Jacksonville in a gorgeous, beach community, but sometimes, I find myself on a daily basis when I'm going to work, what am I doing? I'm thinking about, what's ahead at work, rather than just simply, looking around and observing. Oh, it's a beautiful day today. It's another gorgeous, sunny day.
Yeah, and it really is about choice, because you can drive to work and be thinking about the hard day, the, how many patients or whatever, or you could be looking at that palm tree or the beach, or, the sun, or your son. There's many ways that you can still choose on which you want to focus on. And it really is a practice. And when I start with somebody new, I always ask them for just a week, just pay attention to what you think and what you say. Don't try to change it, just listen to it. Because when you're catching your negative thoughts and you're catching your negative words and actions, I then ask them to pat themselves on the back, because now they're aware of them. And then it becomes a choice. You can choose to have a pity party if you want, or you can choose to reach for a better feeling thought.
Yeah.
It's what's going to be best for you.
And I know it's so tempting too. I think our brains are programmed. It's sort of that
Yeah.
compelling, program that we have. We're like, okay, I got to solve this, and the more I think about it, the more I'm going to solve, the day. And the day rarely goes as planned. And so, that's part of the resilience factor, is saying, okay, I have confidence in myself that whatever is going to come, I'll figure it out. But you know, um, uh, driving to work, you don't necessarily have to spend the entire time thinking about it. You can come up with your one or two things probably within 5 minutes, and then,
Right.
like you said, challenging your brain to sort of switch that off, because continuing isn't really necessary or going to be all that
Yeah.
helpful.
Well,
And yeah,
and sometimes, even like if you're going through something that's really stressful, totally not focusing on it at all. So maybe that drive is putting on happy, fun songs and singing in your car, or playing with your son, or going to the beach, or doing anything to get your mind off of what is stressful. If you can stay in that stress and find appreciation there, that's great. But if you're in a situation where you can't find anything to appreciate about it, then step out of it and move into something that does bring you happy thoughts and kindness.
right. And not feel guilty that
Right.
you're shifting your thought process for a while. If you have to set time limits on it because there's so
Yeah.
much going on, then do that. But when you've chosen for yourself a time frame where you're not going to think about work, I mean, if your mind wanders there, obviously, but when you do catch yourself again, just say, hey, I've got to let this go and let me focus in on what is fun, because that will often happen too, is even when we're trying to
Yeah.
shift our thought process, that our brain still tends to go back to that thing that's bothering us.
Yeah. And it's a practice. And I'm sure that you and all of our listeners here have one or two people in their lives that just know how to push every button that's going to upset you.
Yeah.
And so what I try to do is think of three things I appreciate about that person. But there are times where it's like, nope, not one thing comes to mind. But then I can appreciate the fact that the vast majority of my relationships are easy. So that one person is the contrast to help me appreciate the other people. But really, appreciation is one of my biggest tools that I go to.
Yeah, yeah. Well, and I know often that you talk about contrast, and so if we go back to that question, not why is this happening to me,
Mm-hmm.
but why is this happening for me? You know, uh, a lot of times, sometimes the question is, well, this is a contrasting experience, and it teaches me that this isn't really what I want. Um, this It teaches me that this is what I want something different. And then when we're taking time to sort of imagine or visualize
Yeah.
something different, we have that contrasting experience. And like you said, then we definitely something to be said to, you tend to appreciate you know something when you've gone through a harder time, or something you've experienced something that you don't like. You do have a greater appreciation.
Right. And just like you had said before, sometimes in that contrast, it's hard to be, okay, this is serving me. Certainly at that time, many years ago, when I was working in a company that I really did not like my job at all, at the time of it shifting where I ended up having to leave, at that moment, I wasn't like, oh, this is serving me. It's going to bring me closer to what I want in my life. But it was to the point that I did not want to accept it anymore. And after I got out of it, I was able to see, wow, I could still be there had it not gotten so stressful to make me leave. So it really did serve me. And that was before I was into positive thinking and mindfulness. So now I would certainly shift far quicker than I did then. But there is good things to be seen even in our challenges when we choose to look for it.
Yeah. And this does take practice. So
Yeah.
again, it comes back to, being, like you said, to be gentle with yourself. Because if this is something that sort of hits home with you, okay, I want to be, I want to try to be more resilient. I don't want in my life to have when, I don't want to wake up sort of dreading, every day. I want when things come my way, as they are going to be inevitably throughout a day, I want to just let them sort of pass through me without, always causing, an emotional
Yeah.
ruckus, then, how can I, where do I start? And I think, like you said, a good place to start is just, to bookend your day, with a little bit of, uh, trying to sort of imagine the day ahead as going well. And if you're thinking about it going bad, is sort of really putting yourself to the test of, is it really going to be like that? And then at the end of the day saying, oh, that went better than expected. And then, like you said, in the moment throughout the day, being gentle with yourself, taking a deep breath and then focusing, on appreciation. And I don't know, maybe the first two for sure in a very highly emotional situation. But like you said, in some of the simpler stuff, I think you can definitely get through those first three.
Yeah, and I really think the more you practice it, even the highly charged situations, you're going to be able to move into appreciation so much quicker because you've been practicing looking for things to appreciate in your day and being thankful for kind people and being thankful for when things go well. I think that we tend to take things that are going right or just even going okay for granted, but when something isn't going well, then we start complaining about it or blaming or shaming about it. And that's going to keep us stuck in that space. So the more that we can appreciate, the more things appreciate.
Yeah, absolutely. Absolutely. And then, I would add that question, why is this happening for me? I mean,
Yeah.
it just, even if it doesn't sound true to you or it just seems like a little hokey or kind of fake, maybe just go with asking yourself that question for a week, when things come up, and just see what your own self responds to that. Because maybe initially it might be, oh, this is not happening for me in any way, but you'd be surprised. I think a part of you will also kind of maybe come up with another answer to that question.
Or even look in your past and see, just like my example of work. I suspect that everybody can come up with an example from their past that, sure, in that time did not seem like it was happening for them. But once they stepped out of it, whether it was a day out of it, a week out of it, a year out of it, were able to see how it really did bring some benefit to their life as well.
Yeah, absolutely, absolutely. And again, resiliency, sort of is defined as, sort of being able to reframe how things, happen in your life. And, again, accepting that change is inevitable, reframing how you think about that, and developing an internal locus of control, realizing that there are things that you can control. And one of those things is your perception. And that, it's not the end of the world, no matter what happens. We are inherently resilient people and resilient beings. And, even in the setting of cancer, even in the setting of, terminal illness, there are many, many stories that, even, people in those situations, have tremendous ways that they're able to sort of handle living in that sort of a very gray area of life, and they still can get much, much quality of life. So I
and
think
it's usually extended, even if that diagnosis is what ends up being their checkout point. It's still extended from what it could have been.
right. So we do have a tremendous capacity at human beings to have resilience, and realize that that's within each of us.
Absolutely. And the more you practice it, the more it's just going to be your initial go-to, that you start seeing it quicker. And I don't even think it takes that much practice. Even if you were to, for the next 30 days, write down in the morning things you appreciate before you start your day, I think you're going to notice your days being a lot less stressful just from that 30 days.
Yeah, absolutely. Absolutely. So if you were to sum up what you'd want to, have our audience take away today, Carol, what would it be?
Truly, it would be about being gentle with yourself, because whatever you're going through, the more you're able to be gentle with yourself about it and gentle with the people around you, right there, you're going to lessen your stress. So the more you're gentle with yourself, the more you practice kindness for yourself and kindness for others, which is part of resilience as well. I really think that you're going to find each day, which is precious, a little bit more precious.
Yeah, absolutely. Absolutely.
Don't wait for the weekend to enjoy life.
Exactly. Exactly. Because, today is your day. And, sometimes I will say to myself, I'm not going to let X, but whatever X can be a person, a place, or a thing, spoil my day, because this is my life and this is my day.
Absolutely.
Yeah. So be gentle with yourself, take deep breaths, focus on appreciation, and maybe ask yourself the question this week or in the coming weeks: why is this happening for me? And really maybe try to be an observer.
Yeah, and maybe even when things are going really well, ask yourself, why is this happening for me? Again, I think we try to fix things rather than appreciate and compliment ourselves when we're doing things well. If we've done something wrong, we probably fester about it all week long. But if we've done something well, oh, that was a good job, and then we're on to the next thing within minutes. So really appreciate who you are, because you're here for a reason.
Yeah, absolutely. Absolutely. Well, thank you so much for being here today. Again, Carol. Carol C.C. Miller. She has a website, again, Carol, Carol, C.C. Miller.com. And if you love some of what she has today, is just the tip of the iceberg, and you can find out more about all of her coaching and her positivity at her website. And of course, please follow her on Facebook. I guarantee you it will brighten your day on a regular basis. And if you really like sort of this idea of positivity, check out positivefocus.com. It is a nonprofit that both Carol and I are involved in, that Carol started up. And it's really about bringing positivity to the world, and one person at a time.
Absolutely.
And again, my name is Dr. Sharyl Truty, bringing you their first inaugural health lunch hour chat. Our hope is to continue to have this on a regular basis on Thursdays at around the noon time. Next week, we are going to be doing it, though, on a slightly different day. We will be sending out information on that. We're going to be doing it with the owner of Leaf and Bean here in the Jacksonville area. And she is going to talk about tea, all about tea and how to make it interesting. And that's going to be Wednesday, July 25th. So hopefully you'll get a chance to tune in then. If not, again, when we have our Facebook Live in a couple of weeks. Thank you very much for coming and sharing this time with us today, Carol.
Thank you. It was a pleasure.
All right. Check us out on balancedphysiciancare.com. My name again is Dr. Sharyl Truty, and I'm owner of Balanced Physician Care. Have a great day.
Bye.